Hi everyone! So last week we discussed nutrient deficiencies caused by various types of medications. And today I want to talk specifically about the long-term effects of pain medications. And before we dive into the topic today, I want to share my dad's story. So last week my dad came into my office complaining of severe neck and back pain. He said that the pain was so bad that he's on pain medications and has difficulty sleeping. He looked so tired and worn out, and he also let me know that he felt so depressed because of it. And I asked him what other medications he's taking, and he let me know that he was recently prescribed Celebrex, Lipitor, and Lortab. Those of you who are not familiar with these meds, Lortab and Celebrex are pain medications and Lipitor is for managing cholesterol. And knowing the side effects of Lipitor, which is mostly muscle pain, I asked him to stop taking Lipitor for a couple of days just to kind of see. On Monday, which was 2 days ago, he came back for treatment and was all smiles. He let me know that he didn't have to take Celebrex and that he felt so much better after stopping Lipitor. He's not 100% pain-free, but so much better. He was clearly amazed and I became his hero. More about my plans for my dad later, but let me tell you about Jane. So Jane was a patient who lived a very busy life and had her own law firm. The stress of running her company was giving her tension headaches. And every morning, her day began with a dull throb at the base of her skull, causing her to reach for the most popular over-the-counter painkiller. And she used to wash it down with black coffee. And every morning this was. And immediately she felt her pain melt away. Well, this routine was so effective that it became a habit for her. She began to do this 4 to 5 times a week. And 2 years into this routine, she rose from the toilet one day to discover that her stool was black. Later that week, she felt dizzy and nauseous. So she ended up in the ER and needed a blood transfusion due to upper GI bleeding. She then had surgery to close a perforation in her duodenum, which is your intestine. And in 1999, England Journal of Medicine reported NSAIDs induced GI problems were a silent epidemic, claiming approximately 16,500 lives each year in the United States alone. More than 80% of the patients with serious GI complications due to NSAIDs experienced no prior gut discomfort as a warning sign. So GI ulcers and bleeding are only one part of the equation. The drug manufacturer, Merck, deliberately obscured the risk, but came to light when Vioxx was withdrawn from the market in 2004, after 120,000 people died after taking it. And recently, the FDA upgraded its warning on these drugs, stating that they increase risks of heart failure and stroke, even within the first week of use. And these risks worsen with prolonged use. Ironically, for Jane, when she stopped taking the meds due to gut issues, her headaches vanished in 2 weeks. So NSAIDs and other pain meds can make you become dependent. This is because taking pain meds regularly, up to 3 or more times per week, can suppress your body's natural pain-relieving system. So for my dad, I placed him on a cholesterol-lowering protocol with anti-inflammatory supplements such as fish oil, turmeric, as well as herbals. So what else can you do for those of you who are on pain medications? Well, first of all, eliminate all fatty and fried foods as well as foods high in sugar. Second, eat an anti-inflammatory diet with lots of vegetables, good fats in the form of avocados, extra virgin olive oil, nuts and seeds, good quality proteins such as fish and chicken, preferably organic. You should avoid gluten, soy milk, and any dairy products such as cheese and milk, etc. And for those of you struggling with osteoarthritis, avoid nightshade veggies, in the form of tomatoes, eggplant, bell peppers, etc. Try this for about a month to see if your symptoms improve, especially if such veggies are your staple in your diet. If they're not, then you may be okay. 4, take good quality fish oil. These essential fatty acids help to reduce inflammation overall in your body. And 5, take glucosamine. A study shows patients with moderate to severe hip arthritis found taking 1,500 milligrams of glucosamine sulfate with 200 milligrams of omega-3 fatty acids had greater pain reduction and less morning stiffness than those taking glucosamine alone. 6, quality curcumin. Hundreds of studies link the active ingredient curcumin to anti-inflammatory activity. You should take about 1 to 3 grams per day. And N-acetylcysteine, NAC, is an amino acid which has an anti-inflammatory element that have been well researched. And a daily dose of about 600 to 1,200 milligrams a day is good. 8 is magnesium. If you have muscle twitches, cramps, or tension migraines and aches, it's a sign of magnesium deficiency. The recommended dose is 400 to 800 milligrams a day. Lastly, sleep. Sleep is a critical thing for pain control. Because our bodies regenerate while sleeping, it's imperative that you do whatever necessary to get quality sleep. So avoid eating too close to bedtime. So 3 hours before bed is optimal. Avoid alcohol and any coffee or caffeinated beverages too close to bedtime. Melatonin in a controlled release tab also helps. So while medications are sometimes necessary, as in the case of my dad, he was placed on cholesterol-lowering medications, which caused muscle pain. For that, he was then placed on NSAIDs. The long-term effects of NSAIDs, as we now know, can be detrimental. So taking medications can have a compound effect. Taking medications for one symptom will lead to different symptoms, in which you'll need more medications for. And it's important to think of the domino effect before mindlessly taking a pill. And understanding these consequences will enable you to make informed decisions when it comes to your health. If you or anyone you know needs help with this, I would love to hear from you. So please leave comments below. Also, on my blog, conniejian.com, under blog, for this particular blog, the link will be below. There you can order whatever supplements I mentioned here in this video. Thanks so much for watching, and see you next time.